Hey, I was just going to ask what you would do for a callus that just keeps coming back.
Okay.
Good question.
So with the callus that keeps coming back, there's several different possible causes. A lot of times the average callus or thickened hard tissue that a lot of people get on the bottom of their feet or on their hands, depending on what kind of work they do, comes from rubbing or pressure areas, to where the skin responds to those pressure areas, becomes thicker over time, and then can become painful. There's also other issues with the foot that we deal specifically with. Sometimes callus tissue can be from an issue such as you see commonly in kids, plantar warts, to where they get a plantar wart on the bottom of their foot. That causes callus tissue around that. And so you have to treat it depending on what is truly causing it. If it's coming from pressure, that comes to the shoes you're wearing, to the inserts that you have in your shoe, or if you have adequate support, or if you're wearing, such as from personal experience, when I played soccer when I was younger, which I do not play anymore, the tight soccer cleats always cause callus on the inside of my feet just because of how tight they were around the ball of my foot and would rub on the inside of my big toe and cause a callus. I don't wear soccer cleats anymore, so now I don't deal with the callus.
So a callus is really God's way of adding padding to your foot or to your hand. And if you have excess pressure in an abnormal location, say for example, let me steal the model again, say you had what's called a splay foot, where your metatarsals spread out excessively, or if you had a bunion deformity here and you weren't able to bear all the weight normally under this great toe, which is approximately 50% of your foot weight, you can actually develop a callus here when under your second and third metatarsal heads, by putting excess pressure here. So when a patient comes to me, and certainly to your practice, calluses teach us the history of the weight-bearing pattern of your foot. Very much like when somebody comes to my office with foot problems, I want them to wear their shoes that they wear all the time, not their best shoes. I want to see the wear patterns on the bottom of your sole of your shoe, and I want to see the calluses on your foot. Don't shave them before you come to me, because I want to see if you're callusing excessively here or on the bottom or somewhere in the middle over here. That's very, very instructive to us about abnormal weight-bearing patterns. So to your question, ma'am, if a callus keeps coming back, then something's either wrong with the shoes you're wearing or your posture within that shoe.
That's right.
Or the anatomy of your foot. And I would make an appointment with the Purvis Boyer Center because it should never keep coming back.
That's right.
Particularly if you change the shoes that you wear on a regular basis, if it's not just the same pair of shoes all the time.